Okay, so moving on to the next tab, medications and warnings. This function is pretty similar to the previous eReferrals. What it does is it presents for you any medications that have been ticked as long-term, but also only medications that have been prescribed in the last 6 months. So this does get around the issue that we do have at the moment where you've forgotten to untick a long-term medication that's been sitting there for years, so it won't auto-populate those. If you want to remove a medication, you just click on the delete the row. If you want to add one, you can add a medication and put in something that is not there. Now just remember that there is no write back function in the system at present, so whatever you add here is not going to be written back into the patient record. So again, you've got your medical warnings down here, which you can untick if you don't want to submit those or they're no longer relevant. Everything else is pretty much as it was previously. We have the long-term classifications, patient history, family history. All of these fields auto-populate and they will go through in the referral when you submit it unless you untick them. The patient disabilities has got a slight format change, so if you click yes, it asks you for what kind of disability the patient has. We would ask that you fill this out when you're filling out a geriatric referral form, because this is incredibly important for that service to have included. The other thing I would say is if you're either a nurse making a referral for a patient or you're a GP making a referral for a patient that's not usually your patient, I would ask that you go to the referral details box and complete this section. So the question here is, are you the patient's regular GP? If you are, you obviously don't need to go anywhere near this. If you're not, please select no and it'll ask you to fill out the GP's name. All you need to fill out is the mandatory fields of the GP's first and last name, because obviously this patient's in the practice anyway. This is really important for practice nurse referrals, because otherwise there will be no inclusion of the patient's GP in the referral anywhere. And if you're not the patient's usual GP, I'd suggest you fill this out, otherwise the hospital system will assume you've become that patient's usual GP and change you to that patient's GP in the administration system in the hospital. The other functions that we have added is that there is now a preview function. Now this means that you're able to see the referral as the recipient, the person in the hospital, see it before you would submit it. Now unfortunately I haven't filled out some fields, so it's not going to work. I just warn you that it's a good function to have, but it is quite slow, and what it does do is it takes you back to the clinical section first and then it shows you the preview. But it does allow you to see the referral before you submit it. The other thing to remind you about is that under referral info, that this automatically takes you through to the health link page of relevance. So you're in an audiology referral, so it automatically takes you to the medical professional health audiology page where you can access waiting times or other information that you want to see at the time of the referral. Okay, so I'm just quickly going to take you through the minor changes that have been made to the breast form. So the major changes are that when you click on signs and symptoms, select on the site of concern, then you're presented with the options down here. So the major change is that breast pain has been removed. This is largely because it wasn't being used as intended. So we now have an other for anything that doesn't fit into these three main categories. Breast pain still can be referred to the clinic for imaging, but the only place for imaging in this situation is when it's severe, unilateral, and it hasn't responded to medical management. The other change that we have made is down here where we ask, it's just a prompt where they're asking for you to include any breast imaging, mammogram or ultrasound that the patient has had recently, so that these are able to be compared with what's offered in the clinic. So we'll just look at the changes that have been made to the colorectal form. The first change is that we have added an other option to the high-risk symptoms. This is to cater for symptoms that you are concerned about, that you think are high risk for bowel cancer but don't exactly fit into one of these categories. The other change is that under the mucus, blood, PR or symptoms suggestive of inflammatory bowel disease, it is now, when you select this option, the additional information has become mandatory. The problem we did have in the past was that this was being selected but no further information was added, which makes it really difficult to prioritise that patient for how quickly they need to be seen. The only other option that has been added is that there is this red prompt reminding the referrer that surveillance colonoscopy is not offered to asymptomatic people over the age of 75 years. This is largely because the risk of the screening colonoscopy outweighs the risk of there being actually a cancer found at that time. So here's a brief glimpse of the new orthopaedics referral form. So under reasons for referral, these are the options you've got: back pain, spinal problems, carpal tunnel, pain in limb or joint, or other orthopaedic condition. Each of these has some customized fields. I'd really recommend that you have a look at this before you actually use the form, just to ensure that all the fields are able to be completed before the patient leaves the consultation room. This form hasn't been developed with our input at all, but we would hope that over time, after use, that we will be able to have some input for this to be improved as needed. So we would appreciate any feedback you have on how this form functions for you. So that's the end of what has hopefully been a useful video for you. Just before I go, I'd like to say a big thank you for all of you for the support that you have given me with the eReferral project. It has been pretty challenging, and I certainly know that the product is not perfect by any means, but you guys have been really patient, and I would appreciate what feedback you can give on how we can make it even better. So thanks for your support, and good luck. Thanks. Bye.